Good morning and thank you for joining us today. Teresa is not here today for the YouTube session. As Mother Day is approaching, families may be looking for ways to celebrate the mothers in their lives who have played many incredible roles this past year to keep their families safe. Although the provincial stay-at-home order is in effect, there are many ways families can celebrate their mothers, grandmothers, and motherly figures that honors them while continuing to keep them safe. With stay-at-home order in place, this can be a stressful time for all. Mothers, find time to de-stress and focus on yourself this Mother's Day weekend. Finding time to read, take a bath, practice yoga, go for a walk, or spend time in your yard are great ways to relax your mind and increase your well-being. Staying virtually connected with your loved ones can help reduce feelings of loneliness or isolation. Connect regularly with the people you love most and take time to disconnect from the news and the media. The Windsor-Essex County Health Unit is asking residents who do not live in the same household as their mother or grandmother to connect virtually or by phone instead of visiting in person this year. Residents who do live in the same household as their mother or grandmother should celebrate safely at home and avoid having visitors. Activities for celebrating Mother's Day while keeping a distance include sharing a virtual meal, have flowers delivered to her doorsteps, have takeout delivered to her doorsteps, mail a card or thoughtful letter, plan a virtual game night. Some of the activities for celebrating Mother's Day safely at home, if your mom lives with you: bring her breakfast in bed, plan an at-home spa day, enjoy a backyard picnic, make homemade gifts, have a family game or fun night, help out around the house, help in the garden or with spring cleaning, spend time together outside. Despite the COVID-19 vaccine rollout, strong public health measures are essential to keep everyone safe, even for residents who have received either 1 or 2 doses of the vaccine. I will now turn to share the case rates for today. We now have a total of 15,715 cases to date, which is an increase of 39 cases from yesterday. Of the 39 new cases, 13 are close contact of confirmed cases, 8 are community acquired, 1 is travel related, and 17 cases are still being investigated. In total, we have 366 cases that are currently active. Out of these, 165 of these cases are VOC, and the rest are non-VOCs. We now have a total of 1,080 preliminary or confirmed VOC cases in our community. Majority of them, 988, have been the UK variant, 4 cases have been the Brazilian variant, and 2 cases of the South African variant. In total, we have lost 414 people as a result of COVID. That's no change from yesterday. 8 cases are currently hospitalized, 4 are in ICU. There are 8 active outbreaks in Windsor and Essex, 7 workplaces, and 1 community. With respect to vaccine, we now have vaccinated 169,554 Windsor-Essex residents with at least 1 dose of the vaccine, taking our coverage all the way up to 38.7% overall among all the age group. If we just focus on the 18 years and older, our coverage rate is close to 49% of all adults in the region. I'll now jump into the epi summary for this week. So quickly looking at the number of cases in Ontario, the epi curve for Ontario, and we can see that our third wave was much bigger than the second wave, and we are starting to see slowing of this third wave with the case rates going down in the province. When we are focusing just on in Windsor-Essex, we have seen that we are also started to trend downwards with respect to cases, but still our case continues to be significantly high for our region. Putting those two graphs together, the provincial case rates and the local case rates, we can see the trend is starting to slow down with respect to COVID spread, with all these measures in place, and with the stay-at-home order and the ongoing lockdown measures are helping to drive the case rates down. Looking at our weekly case rate by week, and this captures our rate per 100,000 population starting all the way from week 18th of 2020 to our current completed week, which is week 17th of 2021. And based on that most recent completed week's case rates, our case rate is 73.7 cases per 100,000 population, and which is a slight decrease as is evidenced in this graph compared from last week. If we just look at the last 7 days, this is further reduced to 66.4 cases per 100,000 population. Comparing our case rates with the wastewater surveillance data, and again, this is a research study that used the RT-PCR technology for analysis of wastewater sample as part of the research study, and looking at it from that perspective, it aligns well with our case rates as well. It shows that there is that slowing of these cases and also evidenced by the wastewater data, which aligns well with our current case rates. Looking at our person positivity along Windsor-Essex, in total, 334,798 tests were completed in May 1st, as of May 1st, and this is a complete week ending on Saturday. For the week ending on May 1st, our person positivity was 5.4%. Again, this is also decreased from last week. Last week, approximately 5,493 tests were completed. This slide looks at the most recent 7 days person positivity, and the most recent 7 days are still preliminary and could change. But based on that most recent person positivity, Windsor-Essex has the 11th highest person positivity in the province, sitting at 5.8%, and which is decreased significantly from the provincial average. But the provincial average is mainly driven by Peel, which has the highest person positivity in the region, in the province. Further dividing our person positivity data by different age bands, and as we can see, we have seen some increase in the person positivity between the 0 to 17 age group, and that has started to go down as well, which is now everything looks pretty much similar with respect to person positivity. Person positivity by just looking at this difference between the school age children. In last weeks, we noticed that the person positivity was highest between the ages of 14 to 17. That was the number that was driving the younger age group with respect to person positivity, and they're all trending down, some more than the others, but coming closer to where we like them to see, but again, still some way to go. From a case perspective, with respect to school-age children, case rates are going down, and mainly because of the school closures and some of these measures that are currently put in place and that's driving the number of cases among the school-age children to a level which is good. And again, this is looking at the overall 7-day average with the school-age children average, and they're all aligning well together, both showing a trend of going down with respect to cases. Looking at our cumulative regional and provincial rates, Windsor-Essex now has the 4th highest rate, unchanged from last week. And additionally, the Ontario average has also increased, mainly driven by the cases in Greater Toronto Area and the Hamilton region. And we are sitting at the number 4 with respect to regional and provincial rate. Looking from April 2021 and further zooming it with each of these municipalities, the bulk of the cases are coming from the city of Windsor, followed by Tecumseh and Lakeshore and Essex, and then so on. Similar data, but just from a proportion of cases, more than 2/3 of cases are coming from the city of Windsor, followed by Lakeshore and Tecumseh, contributing to 8% and 6% of the cases, while the rest of the municipalities are pretty much close to each other. Just in the last 7 days, no change. Similar picture with more than 2/3 of cases coming from the city of Windsor, while the rest of the cases from Tecumseh, LaSalle, Lakeshore, and rest of the municipalities, Essex and the rest of the municipalities. From an age and sex distribution perspective, not much difference from the last week. Similar picture with the most of these cases, proportion of these cases are in the younger population, and we can see that the cases in the older or senior population is continuing to decline with the high rates of vaccination in that age group. From an exposure perspective, not much changed. We are still seeing a good distribution of the close contacts and household contacts, and a significant portion of the community spread, as is evidence in this stack graph with red colors. From a proportion perspective, almost 1/3 of these cases are coming from the community spread, and which has been consistent for some time, and the rest of the cases are mainly coming from household contact and close contacts. With respect to variants of concern, we have seen some increase, but since late March, we are starting to see a decline in the number of cases, which coincides with the increase in our daily case counts, and representing that indicating the signal that the cases are slowing down a bit, and but the last few days worth of data should be interpreted with caution because of the delay in the reporting. And if we're just looking at the proportion of these cases in Windsor-Essex, we back in the early weeks of April, we were anywhere between 50 to 60% of our cases were coming from the variants of concern. It has dropped a little bit from 40 to 50% with some occasional spikes, hoping to see that also starts to stabilize in the region. With respect to COVID-19 hospitalization, not much change from hospitalization perspective. A slight decrease with the hospitalization both provincially and locally. And with the ICU, the provincial trend is starting to stabilize with the cases in the ICU. And as we know, our ICUs are being used by some of the other regions who have sent their patients to for our ICU, and we are supporting them in this difficult time. With respect to the people who lost their lives as a result of COVID, the majority of the death happened in the older population. Our youngest person who died in our region was a man in his 20s. Looking at our case fatality rate is slightly higher than the provincial average. In the province, it's 1.7%, while in Windsor-Essex, it's 2.6%. Our case fatality rate at the long-term care home and retirement home is lower than the provincial average, but our community case fatality rate is slightly higher than the provincial average. Our day-over-day doubling time has increased, which is any increase is better, and the gap between the Canadian doubling time and Ontario doubling time is increasing, signaling that we are doing slightly better than the provincial and the federal case rates. Looking at our estimated median R0, it's trending down. Currently, it is sitting at 0.86, which is decreased from last week, signaling that the cases are slowing down in our community. Now, switching gears on the vaccine status, and this graph looks at the total number of doses of vaccine administered to Windsor-Essex residents. In total, we have administered 183,564 doses as of May 6th to Windsor-Essex residents. And this graph gives you a breakdown where we can see some of these peaks are anywhere between 3,000 to 4,000 in different days, with some slowing over the weekend based on the supply of the vaccine. Looking at our coverage by each of the group, we see that our overall coverage with at least one dose is now 37.8% in Windsor-Essex, and the overall 60-plus age group coverage is 83.8%, which is pretty good for our community. And we still want to maximize the vaccine coverage rate in all of these age groups. So anyone who still hasn't received the vaccine in any of these age category, if you're eligible, please register yourself to receive your vaccine as quickly as possible. This is a new graph that we have added, and it basically just showed the percentage of population with at least one doses by age group and by week in Windsor-Essex. And as we can see that in the older age group, 60 to 80 age group, that number is now almost stabilizing, while we are seeing an increase in the younger age group, which has now become eligible anywhere between 50 to 60. And then everything else is lumped together in the last line, which is 16 to 49, and we are seeing an increase in that population as well. With respect to coverage in the hotspot areas in Windsor-Essex, so overall our coverage is 37.8, while the hotspot coverage is 34.9%. And different hotspot postal code have a different coverage rate. For example, N9Y has a coverage rate which is even higher than our regional average, while we have other postal code regions such as NB, N9A, N9C with a lower coverage rate than we'd like to see. And those are the hotspot where we opened up our hotspot clinic with the announcement of the vaccine in the pharmacy with Moderna. These pharmacies will be located in the hotspot areas, so we're hoping that would allow all the residents in those areas to access those pharmacies to get their vaccine through that channel. With respect to where these doses were administered, majority of these doses were administered based on the hospital clinic, followed by the mass immunization clinic, and a significant proportion of these doses were distributed by the pharmacy channel. With respect to the distribution of vaccines, the majority of the vaccines was the Pfizer-BioNTech vaccine, followed by AstraZeneca, and then Moderna. This breaks it down, our initial number of doses by the vaccine type, and as we can see, Pfizer-BioNTech seems to be our workhorse vaccine, and majority of the doses administered in our region is Pfizer. So in summary, the case rates in Windsor-Essex County have decreased this past week. Acquisition source is distributed between close contact and community transmission. COVID-19 related hospitalization have decreased in the province as well as in our region. And wastewater surveillance data remains unchanged from the previous week, which aligns very well with our weekly case rates as well. Our coverage rate in the region is 37.8% so far. With respect to monitoring indicators, our most recent completed weekly case rate is 73.7 cases, but in just the last 7 days, our case rate has dropped down further to 66.4 cases per 100,000 population. Our percent positivity is also declining, which is great, 5.4%, but our most recent percent positivity is 5.8%, signaling some fluctuation between the percent positivity day by day. Our current R effective is 0.86, which is signaling a trend that the cases are slowing down in our region. Thank you.
We'll now take questions from the media. Today we'll start with AMA 100.
Sorry about that, I was listening to the YouTube feed too. Dr. Ahmed, you mentioned how the cases are slowly coming down in the community. Right off the bat of today's daily briefing, you talked about Mother's Day and gatherings. It seems like all this is, they all fit together. Obviously, if gatherings happen, who knows, the case counts could go up. Is that why you want to get the message out there to the community?
Absolutely, and I think one of the thing that we have seen, and as we have evidence that whatever restriction that was put in place a few weeks ago by the province, Now we are starting to see some impact of those cases, that the cases are initially it took some time to stabilize, and then it's starting to show the downward trend. And it is important that we would like to see those cases go down to a level which makes us more comfortable with respect to opening up all of these things. Any kind of an opportunity where more and more people are gathering, that's a recipe for a disaster, and that could lead to widespread transmission. So we definitely want to encourage people, while it's an important time for them to connect with their mothers, it is also important to continue to follow these public health measures, and hoping that using some of these messaging, we should be able to provide the right tool for families and residents in Windsor-Essex to connect with their mothers and on this Mother's Day, and share some of these activities with them in a safe manner.
Overall, since the restrictions have gone into place, are you pleased with how we're doing here in Windsor-Essex? Obviously, like you mentioned earlier this week, you'd like to see like a steady case count, lower numbers, but overall, are you pleased with how we're doing here, how the community has responded?
I think our community really worked hard to keep our case rates down. I think we haven't even recovered from what we have seen from December, January, where our case rates were absolutely through the roof. And so I want to be thankful to the community for taking that seriously and bringing our case rates down and rolling up their sleeves to get vaccinated. So I think it's a combination of all these measures that is really helping us to keep our case rates low. And with increased vaccination every day, we are adding more protection to our community. So hopefully, if all things go well, we should be able to get back to some kind of normalcy in the near future.
And then finally, the current restrictions set out by the province are in place until at least May 20th, so about 2 weeks from now. Has the ministry reached out to our health unit, other health units, to see how things are going? Has next steps started to be discussed?
There has been some conversation going on with respect to different measures, not only just the overall what the opening would look like, but also tagging along with the situation in the school, what the situation in school would look like. So some of these conversations are going. Obviously, there is this desire to not to make any decision very quickly, recognizing that we still have a significant number of population that's currently unvaccinated, and with the variants of concern, things can change really quickly. So there are different channels, there are different working groups that are working to figure out the best way to approach this reopening to ensure the safety and well-being of everyone, and finding that right balance to get back to some kind of normalcy while maintaining the case rates up to a level which is essential to continue to save lives and keep our health system intact.
Any questions from CTV?
Yes, good morning. Just a little bit more on Mother's Day. Are you concerned, being that it's the second Mother's Day in the pandemic, and that more mothers now are vaccinated, that will give people a false sense of security?
Yeah, no, that's a great point. As you rightly mentioned, this is the second year in a row that unfortunately some people may have a difficult time connecting with their mother because of these pandemic restrictions. So I get that part. And also on the same note is having 1 or even 2 doses of the vaccine doesn't necessarily mean that all is good. So you have to be really careful in not putting anyone at risk. We know that some of these variants of concerns can spread very quickly, and the vaccine may not be completely protective in those variant situations. So as hard as it can be for some people to stay away from their mothers, but it is important for everyone's benefit to take the right approach in protecting your loved ones. You definitely don't want to be the one who can end up in infecting your parents in any ways. So try to use all the approaches that we have suggested to keep everyone safe and celebrate Mother's Day in a safe manner.
Do you know how the first day of booking went for the expanded eligibility yesterday? Do you have any indication of how many booked or anything like that?
I don't have a hard number, but I do know that our team was really busy, and all these appointments were immediately taken up, and things are going very well. We definitely like that when people are registering and booking themselves for vaccination, because it helps with the overall protection of our community. The only request that we continue to make is please follow your priority and ensure that people who are booking, they are the eligible population, and if they do not meet the eligibility criteria for one reason or the other, even if they show up at the clinic, they will be turned away. So make sure that that doesn't happen in order to avoid any kind of frustration. People should be very careful in what category that they're booking in and whether they're eligible to receive vaccination under that category.
And do you know of a timeline on expansion to the group 2 of workers who can't work from home?
Well, we are anticipating that would happen within a week or two. It all depends on the booking rates, how quickly and how many people are outstanding in this current priority, because we don't have a denominator. We don't know in each of these categories how many people are eligible. We have a rough estimate, but we still don't know the total number. And even within the total number, how many of them will actually would want the vaccine. So once we get a better picture in the next few days, we'll be in a better sense to see how many openings are available, how many vaccines are projected to arrive in Windsor-Essex, and then we'll open up other eligibility to make sure that we keep this process going.
Okay, and finally, is there an update on which 14 pharmacies will get the Moderna vaccine?
I think some of those details were supposed to show up at the provincial website. I haven't seen, I was supposed to get some details this morning. I haven't checked my email yet because of this session, but if we have that details, if there's any way that we can share, we will share. But on the provincial website, we know that those details were supposed to be posted on this provincial website.
Okay, great, thank you.
Any questions from CBC?
Good morning. Even though our cases are decreasing, we're still seeing, a few dozen a day. I appreciate the info that you provide on that transmission source, but can you speak to the kinds of scenarios that people are most commonly catching COVID, like any common threads that you're seeing, whether it's essential workers who are exposed to the virus through their work, or is it social gatherings? Are there any, common factors that you're seeing?
Well, most of these cases that we are seeing is as a result of a household contact, and just like in the past, because of the variants, these cases are spreading very quickly within a household, so that's the most common thread. The other important area that we are seeing is the workplaces, and that's where we addressed a couple of weeks ago that the workplaces do have an obligation to ensure the safety and well-being of their workers and to review their policies and practices. So we still have a significant number of workplaces that are currently in outbreak, and that's the other area that we are seeing some of our cases. With 1/3 of cases that are attributed to the community transmission, which is a concern, and I don't know if it's truly a community spread, or maybe people are not disclosing if they're having any kind of social gathering, and that's how they're acquiring the disease. To our knowledge, we are not seeing a lot of these type of gatherings related spread, but hoping that people understand that and everyone is following these practices very carefully. Everyone is following the measures very carefully. Sorry.
Thank you. I'd also like to follow up on something from yesterday, just so I'm totally clear. Teachers who are physically present in the classroom but are teaching remotely through, web platforms, are they eligible to get vaccinated at this time?
Yes, teachers whose jobs are so right now there's a provincial order to for the virtual learning, but let's say if that order was not in place and they had to be there in person for the class and for the teaching, they are eligible. We're not talking about those teachers that even before when the schools were open and during the pandemic and they were working from home, those are the ones that shouldn't be eligible, but those who were regularly going to the classrooms before the school was closed, and they are all eligible to receive the vaccine, because they'll at some point the schools will open and they will go back. So we want to make sure that they are eligible to receive the vaccine, and again the language is to make sure that anyone who's unable to work from home. So that's the critical piece.
Okay, thank you. And switching sort of to a different topic, is there any update on the push for a supervised consumption site in our region? Especially given the many overdose alerts that we've been seeing lately. I just wanted to check in on that.
Yeah, no, the work is happening, and there are some challenges in securing that supervised injection site, and what Teresa and the team are working on that in addition to the 1,000 other things that we are doing. But we will be bringing forward some updates for our board meetings in the next few weeks. So hopefully by then we'll have additional updates to report.
Thank you very much.
Any questions from Blackburn?
Yes.
Any questions from the Windsor Star?
Yes, good morning, Doctor. Do you anticipate vaccine eligibility at targeted vaccine clinics will open up to anybody age 40 and over next week as per the provincial's goal?
That is the plan, Taylor. As I said earlier, we just have to see the response to what we have opened up in this week. And if there's still a huge demand from this particular group to continue to register and receive the vaccine, then we may have to look at the right time to open it up. But if all goes well, then yeah, we want to follow as closely as possible to the ministry guidelines to ensure that everyone is aligned.
Thank you.
Any additional questions from AIM 800?
No, thank you. Have a good day.
Any additional questions from CTV?
Yes, just one more. Some U.S. officials are calling for the border to reopen sooner rather than later. At what point do you think, once gradual reopening starts here, that we could possibly look at reopening the border?
Well, I think the key driver, like always, like even for our community, is the case rates, that what is happening with our case rates, and what kind of a risk it would increase if the borders are open. So we'd like to see the cases stabilize in both sides of the border, both in Windsor-Essex as well as in Michigan, and also a vaccination coverage which is at a level which makes everyone feels more comfortable to do that. As much as like anyone else, we recognize the importance of having open borders with our Michigan and Detroit neighbors. We don't want to rush it too quickly and to increase our risks of a spread, especially, and again, I don't want to undermine the importance of the variants of concern. They are there. There are variants of concerns spreading in Detroit and in Michigan. We have some cases. Our majority of our cases are the UK variant, but in the other side of the border, they have other type of variants as well with the significant spread. So we'd like to make sure that it's not rushed and just for the sake of it, and ensuring the safety and well-being of both communities are kept in mind when any of these decisions are made.
Okay, thank you.
Any additional questions from CBC?
No, thank you.
Any additional questions from Blackburn?
No, thank you.
Any additional questions from the Windsor Star?
No, thank you.
Thank you, everyone. Have a great weekend.
Thank you.
Thank you.